Well, good morning, everybody. So here I am peeling potatoes for a potluck for my office holiday breakfast. We do a lot of holiday things at my work, which is kind of cool. But anyway, I was thinking to myself, what should people be looking for when they find a physical therapist? All the time I deal with people saying, different clinics get them in and they think everything's starting off great. They have their initial evaluation and then they come back and they see their therapist for 5 minutes, 6 minutes, maybe 10, 15 on a good day. And then they get shipped off to a technician who does some exercises with them, trying their best, but is managing multiple patients at the same time. That, to me, is not effective rehab. And I'm going to tell you why. So effective rehab is basically when you are going to go see that therapist one-on-one the entire time. You're paying good money to your insurance company for you to be able to do that. Now, we're going to have a whole other conversation about why insurance is actually detrimental to physical therapy quality and business, and it's feeding right into the very problem we're talking about. But that's for another time. Let's get into this one. So, if you're seeing a physical therapist and they're double, triple, even quadruple booking, which a lot of them do, their patients on the hour, then what's going to happen is that you're going to have very limited time to see your physical therapist. This is the person that you're going to entrust your recovery and your care. Now, the issue with all of that is that not that the people are trying to give you bad care, it's that you're going to have difficulty with maintaining proper recovery over time. You're not going to have the ability to have a one-on-one opportunity for your therapist to actually get to know you. It's going to be really difficult for that physical therapist to make a really custom tailored program directly for you and notice the changes that we need to make ongoing. I get patients that have come into me and what we're doing just really isn't working for them. That's normal. That's okay. But I have the one-on-one opportunity when I'm seeing someone for 45 minutes to an hour to be able to make those changes on the fly. If I only see you for 15 minutes, I'm basically going to get to know how your weekend was doing, what you had for Thanksgiving, or how many of these mashed potatoes you were able to make, or got the box ones, no judgment. And then you're going to be on your merry way. Now, if you have like an ankle sprain or total knee and all you really need is someone to coach you and beat the crap out of you, cool. Some high school kid is going to be able to put you through your paces, get you on and off that bike, make you do a lot of exercises, and you're probably going to be well on your way. But if you have something a little bit more involved, say you've had chronic pain for a really long time, been in and out of multiple physical therapy clinics, pain management centers, orthopedic surgeons, and you're really trying to get on top of this thing, then it's going to be really difficult for you with a physical therapist who's not one-on-one with you to be able to make that proper recovery. All that is to say is when you're trying to find a physical therapist to work with and you're doing an insurance-based one, here are some of the questions you want to think about asking. Number one, how long am I going to be spending with my physical therapist? And this is a key here because it's not just how long am I going to be spending per session with you. That session could be an hour, hour and a half, but it may include a lot of different things. How long am I going to be one-on-one with my physical therapist? Is it going to be 15 minutes? Is it going to be 30 minutes? Is it going to be 45 minutes? Is it going to be an hour? Not a lot of clinics are going to do an hour if they're not doing cash pay for multiple reasons, but you may find them out there. Simon's Physical Therapy in Tucson, Arizona is one of them, and I do moonlight over there, so give them a check. But on top of that, the next question is going to be, what kind of therapy do you guys do? Do you have people that do manual therapy, or is this mostly an exercise-based clinic? Nothing wrong with exercise-based physical therapy. I do a lot of exercise in my own clinic, but here's the deal. My personal opinion is that you should be finding a physical therapist that's going to put their hands on you. And that's important for a lot of different reasons. You want to be able to feel what's actually going on with those muscles and tissues. How are they moving? What is the issues that are going on with there? My eyes are pretty good, but they're not perfect. I want to be able to get my hands on my patients and see how they're moving. Do they need soft tissue mobilization to help restore some of that joint mobility? Or are we going to be able to move right into neuromuscular re-education prior to exercise? And that's the next thing to keep in mind here. When you're looking at physical therapy clinics, you want to see, are we just doing exercise the whole time? When you walk into the lobby, are people just going on the exercise bike? Are they just doing band exercises? Or are their therapists sitting with them, working with them, and guiding them through specific movements? If they're doing the latter, then what you're going to be seeing is that they're actually going to be helping that patient relearn how to do an activity. And I talk about that in some of my other videos, but it comes down to the fact that after you restore joint mobility, before you just jump into a regular exercise, you need to be able to teach yourself how to actually do the movement. Our bodies have been compensating with different kinds of ways to get something done for a really long time. And that's a great thing. Your body is designed to compensate so that you can just do your daily tasks, like peeling a potato, without having to think about it. But your physical therapist is going to have to show your body how to do that and guide you through. Then you can get the proper exercise to reinforce that at home before you go swing some clubs. Give it a shot. And one more thing, and I'm an idiot. I forgot to get the water to boil so that I can get these potatoes going before I dice them up and cook them. Anyway, the real big thing is that wherever you go for physical therapy, just make sure you're able to have a conversation with your physical therapist. You want them to be able to know exactly where you're coming from and exactly what you need. If they don't have time for you, you don't have time for them. Find the physical therapist that is actually going to work for you. And if you have any more questions, shoot me a message. Have a good day.